CT triple rule-out is an ECG-gated multi-detector computed tomographic scan which can be used in patients coming to the emergency department with severe chest pain. Three important potential causes: aortic dissection, pulmonary embolism, and coronary artery disease constitute the triple rule-out. Aortic dissection is a break in the inner layer of the aorta, the largest blood vessel in the body carrying oxygenated blood. Pulmonary embolism is blockage of blood vessels of the lungs by clots carried by circulation from elsewhere, usually from the legs. Coronary artery disease is blocks in blood vessels of the heart which may cause a heart attack. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.